Hello.
Hello, sir. Please. Yes. Good morning,
Ah,
sir. Good morning, sir.
right. Good morning. Good morning to all of.
Good morning, sir.
Good morning, madam.
Mahendra, sir. Good morning.
Yeah, good morning, sir.
Good morning. Good morning.
Good morning.
Good morning to all pharmacy staff members and delegates.
Morning, sir. Morning, madam.
Good morning.
Morning, sir.
Good morning. Good morning. Good morning, Shabri, sir.
Good morning.
Good morning. Can you please? Yeah. Hi.
Yeah.
Good morning. Yeah. This is our speaker, today's webinar speaker, Dr. Shabri.
Good morning, doctor.
Good morning, everyone.
This is our dean, Sapna Srikumar, and our
Good
principal.
morning,
Good
ma'am.
morning, sir. Good morning, sir. I am Dr. Prabhu, principal.
Yeah.
Very nice meeting you,
How
sir.
are you? How are
Very
you?
fine, sir. Very nice meeting you, sir.
Same here.
Yes. So we can start by
Yes.
9:30. Now
Yeah.
already 166 participants has been joined.
Mm. I
We
hope now
can
around 165.
yeah
165 joined.
we can
170.
accommodate the maximum we can accommodate in this platform is 250 240.
Okay. Okay.
So so total registration will be more than 700. So we will be remaining things will be screen this this through YouTube channel. We are live. We are not on
Okay.
live.
Right.
We will record and we will send
Right.
to
Right.
the link to the students. Those who are not able to join.
Yeah, that would be fine. Right.
Okay. Okay. Then how is Soja, Shabri? Soja and kids all are fine.
They're fine.
Okay.
It's 10 o'clock here night now.
Night. Oh, midnight. They're on maybe on sleeping. Na?
No.
Verge of sleeping.
Tomorrow is Saturday, Sunday, no school. So
Okay. Soja may be cursing me.
yeah.
uh,
So it's Monday also. It's a holiday here. So
oh,
it's a long weekend.
okay. So, okay. I think I am not too much disturbing you.
No.
Rajeshri?
Yeah, you can start now.
Shall we start?
Yeah, we can
Yes,
start.
Right.
yes.
Yeah.
Hearty good morning to one and all. We, the management and staff of Nehru College of Pharmacy, proudly welcome you to the international webinar on Canadian pharmacists, a highly paid profession by Dr. Sabarinath Chandrasekharan, B.Pharm M.Tech Ph.D. Staff Pharmacist, Costco Pharmacy, Medicine Hat, Alberta, Canada. Once again, a pleasant good morning to all the intellectuals, invited speaker, and our colleagues. It's our pleasure to welcome you all. The Nehru Group of Institutions is a conglomeration of 20 plus institutions with 54 years of experience in the field of education. Starting from the scratch in 1968, our founder chairman late Sri P.K. Das spent each ounce of his energy and sweat to establish 14 prestigious institutions in Tamil Nadu and on Kerala. He was a philanthropist, a visionary, philosopher, friend, guide, innovator, and demonstrator for many of his admirers, and a man of commitment to his vision and mission. This was followed by the P.K. Das Institute of Medical Sciences, established in Vaniamkulam in 2014. Nehru Academy of Law and Nehru School of Architecture are the newest additions to the NGI group. The brand NGI stands for Enriching the Educational Development with emphasis on professional educations like pharmacy, nursing, medicine, and engineering. The vision and mission of the institution, building and matching the expectations of industry and society, are progressing apace, realizing the goals set. The Nehru College of Pharmacy is one of the premier centers of excellence under NGI, involved in carving out a disciplined, well-qualified and patient-oriented care of registered pharmacists willing to take up challenging tasks in industrial, community and hospital pharmacy. The Nehru College of Pharmacy has successfully completed a decade of service and presently is in its 19th year of dedicated service. With constant effort of our management and staff, NCP is got accredited by National Board of Accreditation for B Pharmacy program and also recognized as a research center for pursuing PhD in pharmacy besides existing courses like M.Pharm Pharmacognosy, Pharmaceutics, Pharmacy Practice, PharmD, B.Pharm and D.Pharm. The Nehru College of Pharmacy was established in the year 2003 by the founder chairman late Sri P.K. Das with a visionary seal of serving public of his home state. The college is situated in Godson country on the banks of River Nila and at the foothills of the Vilwadri Hill Shrine Tiruvilluamala in a 40-acre vibrant lush green educational complex. It is centrally located in Pambadi, Tiruvilluamala, Thrissur district. It is well connected by road and rail from all nearby towns including Thrissur, Palakkad and Perindalmanna. The serene, calm, pollution-free surroundings centered by light breeze around make the climate salubrious and the atmosphere conducive for effective learning. We welcome all the dignitaries and invited speakers and our delegates to the international webinar on Canadian Pharmacist, a highly paid profession by Dr. Sabarinath Chandrasekharan, B.Pharm M.Tech Ph.D. Staff Pharmacist, Costco Pharmacy, Medicine Hat, Alberta, Canada. Hence, we welcome you all to this program. Let's start the program with a welcome address. So, I invite Dr. K. Prabhu, Principal, Nehru College of Pharmacy, for the welcome address. Sir, please.
Good morning to you all. First of all, I respectfully welcome our Chairman and Managing Trustee, Advocate Dr. Krishna Das, under whose patronage this webinar is on. And also, I welcome our Principal Coordinator, Dr. Srinivas Nair, and our Advisor of Nehru Group of Institution, Dr. Radhakrishnan, all the three persons in absence here. And I take this opportunity to wholeheartedly welcome the guest as well as the host today, who has come forward to give a webinar to the students of this institution and to other delegates too. Dr. Sabarinath Chandrasekharan, B.Pharm M.Tech Ph.D., staff pharmacist, who has come over here with a wonderful topic related to employability in Canada. And I thank him on behalf of my management, all my faculty members, for this wonderful opportunity, sir. And I also welcome very respectfully our Dean, Professor Dr. Sapna Sri Kumar Madam, for this webinar, and the convener of the webinar, Dr. Prasad, and Vice Principal of Nehru College of our college, Nehru College of Pharmacy, to this webinar session, and who have tried such a wonderful person and a topic to be presented before you all. And I welcome all our head of the departments of Nehru College of Pharmacy, and I heard information that about 700 delegates are joining this program, and I welcome wholeheartedly all of them, and I wish the seminar a grand success. Thank you.
Thank you, sir. I humbly request Dr. Sapna Sri Kumar, Dean, Nehru College of Pharmacy, to kindly introduce our invited speaker for the delegates. Ma'am, please.
A very warm welcome to everybody gathered over here. First of all, it is a pleasure to have with us Dr. Sabarinath sir from Canada. And it is a pleasure for me that our convener, Dr. Prashant KG, Vice Principal, has given me the opportunity to introduce about the eminent speaker. To begin with, I give my respects to our principal, Dr. K. Prabhu, who has supported us in all ventures. My respects to the management, dignitaries, faculties, and students, and all other delegates who have been gathered here. Dr. Sabarinath Chandrasekharan, he has completed his B.Pharm, M.Tech in Biochem Engineering from IIT Banaras University, Hindu University in the year 2002. He has completed his Ph.D. in Cancer Biology from Anna University, commencing from the year 2006 to 2013. From his career prospects, it is seen that he is a very well-known person in the field of cancer biology. As far as working is concerned, he has ventured in many sectors and has worked with high personalities. He has worked from the year 2002 to 2017 in the Department of Biotechnology, Ph.D. College of Technology, Coimbatore. He has been a visiting research fellow in the College of Health and Biomedicine, Victoria University, Melbourne, in Australia from the year 2016. In Australia itself, he was also in the Research and Sales Biosenses Limited in Adelaide from the year 2017 to 2018. There, he was also working as pharmacy assistant in Midnight Pharmacy, Adelaide, Australia. From after 2018, he has shifted to Alberta, Canada, where he was working as a pharmacy assistant in PharmaSave Pharmacy from the year 2018 to 2019. And then he has joined as staff pharmacist in Costco Pharmacy, Medicine Hat, Alberta, Canada. To his credit, he has got 11 publications in international peer-reviewed journals, and all his works has been mainly on anti-cancer related studies, then pharmacokinetics of dietary isoflavones, estrogenic effect of 3-substituted deoxybenzoins, etc. To his credit, he has got 7 renowned projects on production and evaluation of microbial prebiotic for fish feed applications, HSP90 inhibition and apoptosis in lung and breast cancer cells, in vitro system for studying cancer metastasis, a biosensor for water and air quality measurement, aqueous 2-phase fermentation system for production of L-asperginase. These are the some of the high top research works which Sir has carried out in his projects. Apart from that, he is also a life member in 5 organizations, namely American Association for Cancer Research, European Association for Cancer Research, Indian Association for Cancer Research, Indian Society for Technical Education, and also a member of Kerala State Pharmacy Council. To his honors and awards, he has been awarded the Young Researcher Fellowship by DST SERC. He is a gold medalist of Banaras Hindu University. He is the second rank in University of Kerala. He is also having a patent on therapeutic benefits of novel diadzine analogs in estrogen associated disorders. It is a huge pleasure for us to have you among us and to deliver the talk today. And we are very sure that your presence will be helpful to each and every one over here, and especially for the aspiring students who want to go abroad and work. So we are all awaiting your talk. Thank you so much, and thank you everyone for joining here. Thanks a lot.
Now we are moving to the session, and I humbly request Dr. Sabarinath Chandrasekharan, speaker of the webinar, to kindly take over the session. Sir, please.
Uh, Thank you, Rajshri. And first of all, let me thank the Nehru Group of Institutions for inviting me for giving this webinar. And I also thank Dr. Prabhu, the principal, Nehru College of Pharmacy, Dr. Prashant, who is a good friend of mine and vice principal of Nehru College of Pharmacy, and Dr. Sapna Srikumar, Dean, Research, who had introduced me. So, good morning to all. And it's actually 10 o'clock at night here now. So, I will straight away go into the presentation. Okay. Let me just see.
You can share the slides.
Yeah, I'm going to try share it.
You can click present now.
Is it coming up for you?
No. You can click present now. Your entire screen you can present. Present now and entire screen.
Is it right now? Are you getting it?
No. I'm not.
Okay. Okay. Let me just see. Present. Okay. Are you seeing my screen now?
No, Shabri.
Is it right?
Yes. It is coming. It's coming. Yeah.
Okay.
Okay.
Yeah.
Fine.
All right.
Fine.
So, before going into the presentation, just a bit of background about how I know Prashant, because I was working in Department of Biotechnology, Ph.D. College of Technology, and Prashant was working in Ph.D. College of Pharmacy, and we know each other for quite a bit long time. And I was working in Ph.D. College of Technology, Department of Biotechnology till 2017, I think, before moving on to Australia, then from there to Canada. So, and coming to Canada, so Canada, if many of you may be aware, it's a really large country with about 10 provinces, otherwise like equivalent to states, like number of states in India, like that, about 10 provinces and the 3 territories and about 42,000 pharmacists who serve about 3.8 crore population. So uh, it's a large country, and the population is growing, and large number of that population is is having access to healthcare, and there is always a need for healthcare professionals like pharmacists in Canada. So pharmacy is one of the top demanded professions in Canada, and it's also a highly paid profession in Canada. Prashant, are you able to hear?
You are audible. You are audible. You are audible.
Okay, you can see my screen
Yeah,
also,
yeah.
right?
Everything is fine. You can
Okay,
improve. Okay, go
right.
ahead.
So I am now in this province of Alberta here, and I live in a town called as Medicine Hat, which is like a funny name, but its name is Medicine Hat, and that's close to the U.S. border. And this is the place where I've been practicing as a pharmacist also. So becoming a pharmacist in Canada has two parts. One is like you should be a permanent resident or a Canadian resident to practice pharmacy in Canada. Like maybe in Gulf countries, you may not need a permanent residency or anything. You can be an Indian citizen or anything like that, and can be a pharmacist there. But in Canada, you need to be a permanent resident or a Canadian citizen. So that's one part. And the other part is getting the license itself, like the license to practice pharmacy or being a pharmacist in Canada. So I'll try to touch upon both, but the immigration process, I will not go into much detail because uh, that happens on like that's fairly a straightforward method. Like you need to apply some documents and they'll give you some timelines and you need to submit those documents. And if they think that your points are high enough, you'll be having an valid visa as a permanent resident to Canada. Okay, so immigration process is via the Department of Immigration, Refugees and Citizenship Canada, which is a department which takes care of the immigration process. So if you go online and search up for this Department of Immigration, Refugees and Citizenship Canada, then you can there are very simple way in which it is explained, like how to submit documents, what documents are needed, how much fees to pay, and what time frames to expect. Okay, so that's one thing. And if you are a professional, like if you hold a professional degree, then the process is much more faster than if you don't have a professional degree. So the basic idea is like they Canada likes to invite more people who are professionals, like who can give professional service to its citizens. Okay, so coming to the the license part, how to get the license. So the first step for an international pharmacy graduate, that's how Canada names people who have not graduated from Canada, like they're called international pharmacy graduates. The first step is to enroll in the Pharmacist Gateway Canada. So enrolling in the Pharmacist Gateway Canada, like you need to give your information and they'll give you a number, which is called as a national ID number. Now, this national ID number is required for the next step. So this is the Pharmacist Gateway Canada is the common starting point for the whole of Canada, except for the province of Quebec. Uh, Quebec has their own system. It's a province of Canada, but it's more French speaking. So those who are more comfortable with French rather than English, they usually prefer to go to Quebec, and they have their own uh, pathway of licensing. So I'll not talk about that Quebec part, but I'll talk about this rest of the Canada. Now, after enrolling in the Canada, in the gateway, you'll get a number. which is required for the next important step, which is through the Pharmacy Examination Board of Canada, or PEBC. So in the after getting the national ID, you go to PEBC and apply for the document evaluation. So the document evaluation, basically what do they do is like they'll analyze your transcript, analyze your degree certificate, and also if you're claiming to be a pharmacist, then you would have been registered under, say, Kerala Pharmacy Council. So they'll analyze or assess your licensing statement, like the Pharmacy Council statement that you are a pharmacist. Then they'll also assess your identification documents like passport or something like that, and they will evaluate your documents and say that Canada recognizes your degree as similar to the pharmacist degree given by the Canada. So basically, it is like uh, uh, making sure that both the courses, what is offered in India and in Canada, are similar in the content. That's why they ask for the transcript. That's why they ask for the certificate, degree certificate, and also from the Pharmacy Council. So these need to be sent, like the degree certificate and the transcript needs to be sent directly from the university, and the licensing statement and the good certificate statement from the Pharmacy Council need to be sent directly from the Pharmacy Council. So practically, the university is not going to spend like 3,000 rupees or something to send a document to Canada. So what normally happens is like the candidate will get the sealed cover from the university and send it by themselves, or otherwise get the sealed cover from the Pharmacy Council and send it over to Canada by post. So, so this usually takes about 8 weeks, like 2 months. Once they get your documents, they will take about 2 months for the evaluation. And once your documented are evaluated and approved, it's valid. Its validity for the approval is for about 5 years. So, which means like this evaluated document, you can use it for your immigration purposes to claim or to say that you're applying as a pharmacist for immigration. And also, the evaluated document, you will have what is called as a PEBC ID, or a number, which is a unique number, and that unique number is needed for the subsequent examination. So what happens in the document evaluation is like you are sending your transcripts and university uh, degree certificate and your pharmacist certificate to PBC, and they are going to evaluate it. They'll go through the transcript to see like your content is similar to that of the Canadian system, and they will uh, approve it. And this approval, you can use it for applying for your immigration and as well as for your examinations. Okay, so currently the minimum requirement is like a 4-year degree. A 4-year bachelor's degree is what is needed to apply as a pharmacist or to do the licensing for the pharmacist. Any questions? If you have any questions, you can always raise your hand or interrupt
I
me.
think one Nandu C has raised his hands. Whether you have any questions, Mr. Nandu? Okay, I think maybe it may be a mistake. You can proceed, sir.
Okay, no problem. Okay, so once once you got your document evaluation, then comes the examinations part. So there are two uh, two sections to this examinations. One is called the evaluating examination, and the second one is called the qualifying examination. And the qualifying examination in turn is made up of part one, which is called as an MCQ or multiple choice questions, and part two, which is called as an OSCE or objective structured clinical examinations. We'll come to these more details on this in a minute. So evaluation examinations, this used to be conducted in Canada and in London, I think, before, but now because of this COVID and everything, now they are doing a remotely proctored exam. Remotely proctored exam means that um, you can take this examinations in at your own home using a laptop, but somebody will be remotely observing you. So you need to install a kind of a small program in your laptop, and then so that some supervisor can observe you through your laptop camera to make sure that there is no cheating happening, and examinations are done online. And there are now test centers in India too, like in Chennai, Hyderabad, Gurgaon, Calcutta, I think, Ahmedabad. A few test centers are there where you can go there and write these examinations too. Uh, right in the sense like it is still a computer-based examination. So there is about 200 multiple choice questions, and there are no negative markings, and the pass mark is 60%. Like out of 200, if you're able to get 120 questions correct, then you pass the evaluation exam. So the evaluation exam is a basic exam which will evaluate or which will find out, or what they're trying to evaluate is like the basic knowledges like in pharmacology, in anatomy, physiology, pharmacokinetics, some physical pharmacy, some pharmaceutics, some therapeutics, and some questions which are more Canada specific. Like, for example, like who regulates drugs in India? It's like the drugs controller general or drugs controller of India. So similarly, there are some authorities, regulatory authorities in Canada too. So there are some Canada specific uh, questions asked, but mostly it is the undergraduate level questions I think I have some sample. So this set of sample questions I have taken from the PEBC website. There are some samples given, sample questions given there. Like you can see that there are like mostly straightforward questions, but there are also some questions which are calculation based, but everything is MCQs. And there are some questions which are more clinic based, but mostly at the undergraduate level. So the purpose here is to see how uh, whether your level of knowledge is equivalent to a fresh graduate coming out of an Canadian pharmacy school. So that is the purpose. So that is the purpose of the evaluation exam. Okay, so evaluation exam uh, is offered twice a year. At, uh, uh, when are they offered? I think I have a slide coming up. And after once you clear your evaluation exam, then comes the uh, difficult exams called as qualifying exam. So evaluation exam, once you clear it, then you can apply for the qualifying exam. So qualifying exam, it consists of two sections or two different exams. Even though it's called part one and part two, they do not they are not done on the same day, but on the same month, but not on the same day. So part one, which is called as MCQ exam, is a 200 multiple choice questions, but the some percentage of these 200 will be experimental questions. Experimental questions in the sense like they are not evaluate they the marks got in that questions are not counted towards your marks. Like for example, say uh, 10% of 200 is say ten questions, are experimental questions, then your marks are based only upon 200 minus 10%, and that is 200 minus 20, like 180 questions. So the candidate will not know which questions are experimental questions and which questions are evaluated questions. And there's a 4.5 hours. And right now, to my understanding, the MCQ examinations are done in Canada only. So the person needs to be physically present in Canada to do this examination. It may change also based upon how the COVID situation changes. And here, another difference is like it is unlike the evaluation exam where it was like 60%, uh, if you score 60% of your questions correctly, then you pass. Here it is different. Here there is a criterion referenced pass fail standard. So basically what it means is like for each exam, there will be a panel of experts who will try to say that, or who will say that if the candidate is able to answer, let's say, 70% of the questions, then he is passed. Or sometimes, if the questions are too tough, then the panel may say if the candidate managed to uh, clear 55 percentage, then he can be declared pass. So it is not. It is different from the evaluation exam, and it is not really as transparent as the evaluation exam because there is a criterion referenced pass or a fail standard is there. So what exactly is this and who are the panel of experts? I don't know, or we don't know. Only the PEBC knows that probably. And so this qualifying exam is more clinical oriented. I hope everyone can see these questions. Any any questions or any doubts?
Sir, good morning. So I have small
Yeah.
doubt.
Yes.
Sir, after completing UG, we can directly apply for PR, or do we require any minimum experience, years of experience for practicing in Canada as a pharmacist? So
Yes.
do we,
So if you have experience, if there is experience, that is counted as more points. Like Canadian system is a point-based system. Like immigration is a point-based system. So if you have work experience in that profession, then that counts as more points. So there are points for your age. There are points for your IELTS score. There are points for your experience, and there are points for, like, for example, your spouse, how much IELTS score a spouse is having, and there are points for what is the highest level of qualification you have. So there are points for each, and if you are able, if you qualify for a certain number of points, above a cut-off number of points, then the immigration process is like that. That is the normal way. And also there are other ways of immigration too. Like for example, I told there are several provinces, and some provinces may sponsor in the sense like there may be some provinces which requires more of that particular profession. And in that case, the province will sponsor you in the condition that you have to stay in that province for a required period of time. So there are multiple ways in which PR or immigration works.
okay, thank you very much for your clarification.
Okay, no problem. So if you go to the immigration website, there is a questionnaire or a tool where you can give your information, and then it will automatically say that whether you are eligible or not. It is not the selection process, but it is only like a trial process where you can give the information there, and then it will calculate the point and then give you like whether you're eligible to apply or not. So that's also there.
Yes,
Any
Ajit Unnikrishnan has raised his hand. Any query?
Yes, sir. Good morning, sir.
Good
Sir,
morning.
what is the validity of this evaluating exam, sir?
validity of evaluation exam is document evaluation is 5 years, but evaluation exam I don't think there is a 5 year. I think it's about 3 or 5 years. I'm not really remembering at this point. It's either 3 or 5 years. Like once you finish your evaluating exam, and if you want to go for your qualifying exam, it should be taken within 3 or 5 years, I think.
Okay, sir. Thank you.
Okay. Okay. So so this is again like one of the sample questions from the PEBC website about the MCQ question which is being asked. So when you see this question, I'll give you some time to go through it. Okay, so now you can see that it's more clinical oriented. So uh, the candidate should be knowing the approximate daily doses of medications, and also he should be knowing the in this case, is it like time specific or not? For example, the zopiclone. Um, what is zopiclone? Anybody? Zopiclone. Yeah.
Anybody you know to Sopiclone? What is the use of Sopiclone?
Okay, that's all right. Uh, okay, so some may be knowing, but end of the presentation back again. So zopiclone is used for helping to sleep, or hypnotic or sedative. Uh, so at bedtime, and so you should be also be knowing like what is TID, PRN mean. So now it is more clinically oriented. So you should be knowing like what how pharmaceutical abbreviations are done, and does it make sense? Uh, so whether there is an interaction occurring between some medications, and in this case, the answer is going to be C because it's ibuprofen without gastroprotection, which is causing the stomach upset uh, for this particular case. So, so things like this. So it's more clinically oriented, and it's less of physical pharmacy, less of medicinal chemistry, less of pharmaceutics and things like that. It is more of clinical pharmacy, which is being tested in the MCQ or the part one of the qualifying exam. Okay, so now coming to the last part, like the OSCE or the part two. And OSCE or the part two is kind of unique because it consists of stations. Stations, you can think of them as like Viva rooms where the candidate will be there, then an actor will be there who will be playing the part of a patient or a doctor or a nurse or a mother who is picking up a medication for somebody or something like that. An actor who a trained actor will be there, and also an evaluator will be there, which will be like a trained pharmacist. So a trained pharmacist will be there who will be an evaluator to check uh, your performance. So in these, there are, I think, about 11 to 12 stations. for this exam. And each station, the candidate is given about 7 minutes to complete the task. So this task can be like counseling or counseling to a particular patient, or identifying a drug therapy problem or an ethical dilemma, or screening or evaluation for a new prescription, or checking the dispensed prescriptions for accuracy prior to release. So OSCE is really very close to what actually happens in a community pharmacy or in a pharmacy. Uh, and so this exam is like a crucial exam. So even if you know many theoretical basis and answers for theoretical questions, but when it comes to actual practice, how do you interact with a patient, or how do you interact with another healthcare professional, and can you do it in a limited time? Can you quickly identify the references? So those are all evaluated in this OSCE. Like, I'll show you a video. Uh, this is, of course, from an coaching center, or whatever you can call a training center, who offers OSCE training. But it's really a good video, and to demonstrate what actually happens in OSCE. Okay, so mm, 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 mm. So I'm going to turn on the captions, because and the captions, closed captions, will not be the exact subtitle, but it should be fairly close enough. So the lady on the white in the white coat is a candidate, or is the student who is taking the exam, and this old lady on the left side is the actor. So who is playing the part of an patient. Okay, so. Mm,
I've got pulmonary arterial hypertension.
Yeah.
Oh, okay.
It's like so.
You have high blood pressure in your lungs? Yes. Okay. Yeah. Okay. And are you taking any medications? Yes, I'm taking two, actually. I had to write them down. One is digoxin, and the other is diltiazem. Okay, so you take digoxin and diltiazem? Yes. Yeah. Great. And do you currently know the doses of those by any chance, of the two medications? No, I can't remember, but the doctor said I was taking quite a high dose and it wasn't really having any effect. I see. Okay. And are you taking anything over the counter, like Advil or Tylenol? No. Okay. And do you take any vitamins or herbal supplements? No, nothing like that. No. Okay. Did the doctor tell you about this medication he prescribed for you called Revatio? Did he tell you what to expect from it or why he was prescribing this for you? Well, I went to see him because I got increased shortness of breath, actually. Okay. And he said that the current medication I had really wasn't working, so I ought to try something different. I see. Okay. And did he tell you anything specifically about the medication he prescribed, the Revatio, or? Not really. I think he was expecting that, from the pharmacist. Okay. Okay, no problem. So I'm just going to look over this, and then we can talk a little bit more about this new medication your doctor has prescribed for you. Right. Okay, so the medication the doctor prescribed for you is known as Revatio. It contains an ingredient called sildenafil. That's the chemical name, and it's also a similar medication that's used for Viagra for erectile dysfunction. So I heard that. Yeah, somebody told me that. Yeah, you may have heard that. So even though it contains a similar ingredient, in your case, the Revatio is used specifically for pulmonary arterial hypertension. Okay. So it's perfectly fine for you to use, and the dose is 20 milligrams, and you're going to take that 3 times a day. 3 times. And it's recommended to take it about 6 to 8 hours apart, and you can take that with or without food. One important thing is it's important that you don't take it with grapefruit juice. So I don't know if you have grapefruit juice. No, I don't drink that very often, but that's interesting. Yeah. Okay, that's good. So you should avoid that because it can lead to increased levels of this medication in your body, and you can experience increased side effects. So we don't want that to happen. Okay. So with this medication, again, you're going to take it 1 tablet 3 times a day. And I just wanted to tell you about some side effects that you could possibly experience. Yeah. There's a few serious ones that I just want to warn you about that are rare, but if you should ever experience this, then you should stop taking it and see your doctor immediately. So if you ever notice any severe skin reaction like blistering or peeling or any pains, then in that case, you should stop taking it and go see your doctor immediately. There's some other side effects you may or may not experience again. Some of them involve feeling flu-like symptoms. Some people have complained of a little bit of difficulty hearing or some vision disturbances. Oh, okay. Yeah, so there's just some things to consider. Again, they're rare, but I just want to make you aware of them. And some of the more general side effects are things like headache and nausea that you might experience with this medication. Yeah. So with this medication, it's very important that you take it as prescribed, and hopefully this medication will help your condition, which is known as the high blood pressure in your lungs. So what it does is it targets the vessels between your heart and your lungs, and it helps widen them. So hopefully you'll be able to have better sensation of breathing, and you won't have as much shortness of breath in doing your daily activities. Great. So do you have any questions for me about anything, or? No, the only one I was going to ask about was, you've already mentioned, was the Viagra part. Is it okay for women to take this medication? That's a good concern. And as I mentioned, Revatio is used for high blood pressure in the lungs, and the chemical ingredient is also used for erectile dysfunction. But in your case, this medication is for the high blood pressure in your lungs. Okay. No, that's fine. Okay. Great. Well, if you have any additional questions, please feel free to call us. Yes, I will. Thank you very much. Okay, thank you.
Okay, so that was a presentation or a sample OSCE thing, and so you would have noticed a few things like language, like the language in the sense, like I'm not talking about the English as such or the grammatics of the English, but more about like the way in which the pharmacist has to explain the medication to the patient. Like it should be in a language which is understandable by the lay person, like using terms which are not medical terminologies, but trying to explain them in a way which can be understood by a common man, like using instead of hypertension, using the term like high blood pressure, or instead of diuresis, instead of that, using going to the washroom more often, or things like that. And empathy in the sense like when the patient said like she's having trouble breathing, so the pharmacist has to empathize with that, like so, and also giving the correct information, and also educating the patient about when to take it, how to take it. Do not take it with grapefruit juice, or when can she take it with food or not food. And also very importantly, like if she has more questions, sometimes a pharmacist will offer to call the patient to see in a couple of days if there is any side effects. So this is what typically what happens in a actual pharmacy also in Canada. Like when a new prescription is brought in, you need to talk to the patient about, is this medication correct for his or her symptoms, whether this is in the correct dose, whether the patient is okay with it, all the side effects. Even after explaining all the side effects, if the patient does not want to take the medication, then it is the patient has a full right to say that I don't want to take the medication. So uh, practice of pharmacy is very patient oriented here. So it is up to the patient to decide whether he wants to go with a medication or not. So it is a duty of the pharmacist to give the correct information, including the side effects, explain how it is working, and explain what side effects are expected, and what to do when a side effect happens. Like you can call the pharmacy and ask what happens. So it is really very patient oriented. Like it is not like the doctor will prescribe a medication and the pharmacist just gives that to the patient and the patient has to take it for sure. So it's not like that. So uh, so the emphasis is a bit different in the community pharmacy. Like what the patient wants is what we have to provide. So if the patient wants more information on the medication, yes, we have to provide more information on the medication. Or if the patient does not want to take the medication, then the patient has a full right to do that. So this is what is observed in the OSCE examination also. The evaluator or the examiner will observe how you're interacting with the patient. Are you interacting with the patient confidently? Are you keeping good eye contact? Are you able to uh, assess if the patient is uncomfortable, or if the patient has any other questions, or did you give the correct information? Did you put the patient at risk? So all these are what is assessed in a station like this. So and the evaluator does not expect you that you will remember all the information about all medications. So there are, of course, reference materials kept there, but you have a limited period of time. So you need to quickly go through the reference materials to get the informations which you need and which is required for completing that particular station. Okay, any questions?
I have one
Any?
question. Yeah, can the candidate use any mobile gadgets or such things for getting the information during the station in the
No,
stations?
no. In if you notice there in that video, there are like reference books kept there,
Mm.
usually like books only, or there may be an information printout kept there, like a monograph or
Mm.
something like that, or a manufacturer's information. But we cannot use any electronic devices for information. So it's more like finding out from the reference book quickly where the information is there. So we cannot use mobile phones or anything like that.
Okay. Okay. Thank you.
Yeah.
I
Any
think you can
other?
continue. No queries. I think you can continue.
Okay. So communication is a very important aspect in this OSCE stations or OSCE or final step. And uh, how much? So that's about all the examinations which are there. And each exam is offered twice a year in January and June for evaluation exam and qualifying exam in May and November. So if a person is able to clear the January exam and clear the May exam, then theoretically he should be able to complete both exams in about 6 months. But practically it doesn't happen like that for most cases. And also, once you complete all these examinations, before you get your license, there are still some more steps to go. One thing is the IELTS or the TOEFL for the English, and you'll require, uh, in case of IELTS, you need to take the academic IELTS and minimum score in each of the section, like the speaking, writing, reading, and listening is 6, and overall it's minimum of 7. So IELTS is the common one which normally people take, and that's the language requirement for uh, before registration. So it's IELTS is really important here because you will be talking to the patient, you'll be listening to the patient, you'll be sometimes you have to write something for, let's say, for a doctor, or you may have to get information from a written material like reference material. Sorry. So getting the IELTS is very important for making sure that you can score very well in OSCE and also for your pharmacy practice also, especially the listening skills and the speaking skills are really important here. And jurisprudence examinations are required because, as I told, each province has in each state or each province has their own rules regarding medications. So in some provinces, some medications may be requiring a particular type of prescription from the doctor. In some other provinces, it may not need that kind of prescription. So jurisprudence examinations are given by each provinces according to their own laws or their own rules. So that's more simpler examinations. It's a short computer-based examination to finish the jurisprudence. And some provinces also provide bridging programs. Bridging programs are programs offered by the pharmacy councils in those provinces, which an international pharmacy graduate has to take before he can practice. So the idea there is to fill the gap in the knowledge or the competencies of the international pharmacy graduates when they come to practice in Canada. So bridging programs are offered not in all provinces, but some provinces require that international pharmacy graduates take that bridging programs also. Internship. Internship is like once you finish all your OSCE, MCQ, evaluation exam, etc., then you can work as an intern pharmacist in a pharmacy under the supervision of a registered pharmacist. Like what it's almost like house agency or internship in an hospital, pharmacy, things like that. So you'll be working as a intern under a registered pharmacist in a community pharmacy. So for example, in Alberta, where I did my internship, I had to do about 1,000 hours of internship under another pharmacist. So during this time, they will evaluate your communication skills, your clinical skills, your ability to manage time, your accuracy, and all. There are many different aspects which the registered pharmacist or your preceptor will evaluate you. So once you finish all this, then yes, you are licensed. So any questions on the entire process?
I think nobody has raised the hands. Okay, you can
Okay.
proceed.
Okay.
Hello, hello. Sir,
Yes, somebody is there.
oh, yes, sir.
Yeah.
So I have one question. Probably how long time it will take to get a certificate, the pharmacist certificate in Canada, or any age
Okay.
limit also is there, sir, for applying this one?
There's no age limit, but I'll tell you like how much time I took. Um, yeah. So I moved to Canada in May 2018. So I was, I think I was 40 years of age at that time. So I took my evaluation in June 2018, and I took my MCQ and OSCE in 2019, November. So I cleared both exams in November 2019. So from 2018 to 19, I was working as a pharmacy assistant in one of the pharmacies, and I did my internship January to December 2020, and so I got my license in December 2020. So maybe I took about a year and a half to complete the entire thing. So usually, and you are allowed like three attempts for each examination. So each exam you can, if you don't pass it in the first test, first try, you can attempt it for two more time. And if you are not able to pass in three times, they may give you a fourth time if you apply with some valid reason. So yeah, so that is usually as per the PEBC website, the average time an international pharmacy graduate takes is about 2.5 years to complete the whole process. But that's average. But minimum you can complete within an year, maybe, um, if you pass both the exams in one try. Okay, does that answer that question?
Yeah, yeah, it's thank you. And before that, for applying all the examination, for appearing examination, we can write in from India, or we have to go to visit Canada after getting PR.
You can write your evaluation exam right now in India. Uh, Before that, it used to be in Canada or in London, but now you can write it in India. And the MCQ examinations and OSCE examinations, right now, it is done only in Canada.
For visiting Canada, whether we can visit on that is a transit tourist visit, or we have to get a PR, then only we can write this examination, MCQ.
No. Like when you're applying for these examinations, you can use like use the approval letter. Like when they say that you are approved to write this examination, you can use that approval letter to apply for a visit visa kind of thing, a temporary visa. So that will allow you to come to Canada to write the exam. That's one option. So they can provide you, like the immigration can provide you as a short-term visa, provided that you have a valid reason, and that valid reason is like you're coming to Canada to write the MCQ or attend the OSCE examination, like that.
Okay, thank you, sir. What about cost? Is how much it will take for entire process?
I'm Yeah, I'm not sure about the cost, but it's on the PBC website, like each exam, how much it takes. I know that the final OSCE examination is costly about $1,500 or something, and MCQ is about $800 to $900, and evaluation about 800 to $900. So uh, even the immigration process also, for myself, I did not go through any agent or anything. I just did all by myself. So it is much more easy to do all by yourself, and it's much more cost effective to do by yourself rather than going through an agent. But I think these are the fees for each of these examinations.
Okay, thank you, sir. I think entire process will take around 5,000 Canadian dollars. At the rate of that is 60 rupees. I think 60 rupees 50 paise. I think per Canadian dollar. I think 5,000 into 60 means I think it will take around 6
3
lakhs.
lakh or something. Okay. Yeah. Yeah. I think about for all the examinations, you will have about 3,000 to
Including PR,
4,000.
yeah, including PR.
Yeah. About $3,000 for the examinations and other one that for the PR. Yes.
I think Kirtana has raised her hand. Can ask next?
Let's know whether M.Pharm PhD can apply for these.
Uh, right now, the basic degree which they look only is the B.Pharm degree, like the graduate program, the undergraduate degree. So even if you have M.Pharm or PhD or anything like that, they will evaluate you as a pharmacist based upon your pharmacy degree.
Okay, sir.
Okay.
So one
Okay,
more
Shabari, you
question.
can.
I have one more question, sir. Because here for
Uh-huh.
engineering and all, if you complete a master degree, they will consider as the there is UG, ME or M.Tech. If you complete, they will take it as the B.Tech or B like that. Like that, any if you complete a master degree M.Pharm, they'll consider as the B.Pharm. Or if you complete only if you are applying only with the B.Pharm, whether they'll consider as the equivalent to B.Pharm or they will consider as the lesser in
No,
Canada.
they look only at the B farm. They look only at the B farm. That's what your qualification which you are evaluating for. So even if you have M farm or Farm D or any other also, they look only at the B farm degree.
Whether we have to get the equivalent certificate for our degrees of B Farm. Suppose if we are applying only with the B Farm, whether you have to get
Yeah.
the equivalent certificates from
You
World
mean
Education Service, yes.
you mean B farm, like B farm or D farm?
B Farm, pharmacy, B Farm, Bachelor of
Bachelor of
Pharmacy.
Pharmacy. Okay. WS is a different process. Like WS has nothing to do with the PEBC examinations. So WS gives the equivalency certificate, but of your qualification. But PBC is also takes into account your pharmacy council registration also. So that's WS and PBC are two different processes. So I know that the WES is used for, like, say, if you are applying for PR as, I don't know, maybe as an engineer or something, you need to give it to WES to say that your degree is, you're applying as an engineer, to say that for them to consider you as an engineer. Yes, but PBC is what is required for when you're applying as a pharmacist.
Okay, okay, thank you. So after getting this, clearing all these exams, how long we can stay in Canada, sir? So permanently we can stay, or any valid, there is a limitation is there, sir. So valid for
No,
5 years or 10 years.
no, I think the PR, the permanent residency, is now given for I think 5 years now. But you can renew the permanent residency, or you can apply for Canadian citizenship after 3 years of staying in Canada. 3 or 4 years, I think. So uh, PR validity is, yeah, PR validity is 4 5 years. So Pharm D is also considered as an undergraduate degree or as a pharmacy equivalent degree. So if you have Pharm B Pharm, a Bachelor of Pharmacy, or Pharm D, uh, it can be applied to PEBC.
One more question, sir. Because here Form D is equivalent to that is a MBBS doctorate. So
Hmm.
whether we can apply for a equivalent to MBBS in Canada, sir, after completing Form D. Because I can know that
Uh,
MBBS for practicing in Canada, we have to write some examination like BBC. Whether with the
yes.
Form D, whether we can apply for MBBS, equivalent to MBBS in Canada. Sir?
No, no, I don't think so. Even those who are like say doctors or nurses or whoever, professionals who are coming to Canada, they are required to write their here the exams here to make it equivalent. Like for example, what I'm saying is like even if it is an MD doctor coming here or an MBBS doctor coming to Canada, they still have to write examinations like PEBC to make their degree work here. So even for Pharm D, I think Pharm D again is like a pharmacy degree, so it'll be considered as a pharmacy. And Pharm D is also offered in Canada also now. Many some universities have started giving Pharm D also, and mostly they go for like hospital pharmacy or also community pharmacy. So Pharm D, even if you're having, you'll be still has to be evaluated through PBC. And Pharm D, they don't consider them as equivalent to medical degree like that. No.
Okay. Thank you, sir. Thank you very much.
Okay.
Okay, I think you can continue, Shakti.
Okay. So I'll quickly go through this. So a pharmacy in Canada has like a pharmacist, pharmacy assistants, and pharmacy technicians. So pharmacy assistant is like a non-regulated professional, a non-regulated person. So pharmacy assistant help with medication packing and things like that, but they cannot do any prescription checking. So uh, and also uh, code of ethics, like this is what each pharmacist in say Alberta has to uphold. So if you can see, you can see easily see that out of the 12 codes of ethics, the first five are always related to the patient. So the patient she is given the highest position here, and not the doctor or anybody else, not even the pharmacist itself, but the patient itself. So autonomy, dignity, confidentiality, right to healthcare, all these things are all patient related. And also, we are expected to uh, collaborate with other healthcare professionals and also to keep ourselves update. So since and if scope of practice in Canada, here the scope of practice means what the pharmacist can do in different provinces. So I am in Alberta. So these all the blue ticks are the things which a pharmacist in Alberta can do. Like he can prescribe a medication, just like a doctor, but not equivalent to a doctor. But he can prescribe, say, an antibiotic or things like that. He can adapt or manage prescriptions, like he can change one prescription to another one. Like for example, let's say changing from amoxicillin to ampicillin without consulting the doctor. The pharmacist can give injections like subcutaneous or IM injections, like flu vaccines and things like that. And the pharmacist can order labs, like suppose you want the patient to go and check for his TSH level or thyroid level, then he can give a requisition form for the patient to take to the lab, and he can get it tested. So the and also before, other than dispensing, the pharmacists are also expected to take part in the patient care system by constantly or periodically assessing the patient or interacting the patient to identify drug related problems. So drug related problems can be like maybe the patient has started a new over the counter medication which the pharmacist did not dispense, or he may be taking a supplement which is interacting with the medication he's taking, or the patient is not using the medication properly, like he may not know or he may have forgotten how to use a salbutamol puffer, or he instead of taking a medication in the morning, he's now taking at night, or there may be some side effects or adverse effects which may have come up. Maybe the patient is now diagnosed with a new disease. So all these things, the pharmacist is expected to talk to the patient, find out if there is a drug related problems, and then come out with a solution to solve that problem, and also interact or collaborate with the prescriber like the physician or other healthcare professionals, like there may be a home care nurse who is giving the medication. So collaborating with those kind of healthcare professionals to overcome this drug related problem. So this is about pharmacists too, like going beyond the simple dispensing of medications also. So uh, it is a very responsible job which requires higher responsibility, and also which means that uh, you are observed by both by the patient as well as by the uh, regulatory authorities in the province to make sure that you're doing the right thing. So you're highly accountable for and highly regulated, so that you are doing everything in the best interest of the patient. So job markets are currently good, and also the average annual earning, if you look for a pharmacist, is about $80,000 to $100,000 in a year. So comes to maybe, I don't know, maybe 55 to 60 lakhs a year, of course, depending upon the exchange rate. So it is a really good job, like when you get to the license level. So uh, when I came here in 2018, I joined as a pharmacy assistant, and that one was like minimum wage job, but it helped me a lot for working in a pharmacy, understanding like how the pharmacist deals with different situations, because it's totally different from, let's say, from India or even from Australia too. Like how patients are counseled, how a prescription is dealt with, how a medication problem is dealt with a pharmacist. So that kind of experience was very useful for me. And a pharmacy assistant job is at that time I was lucky to get that job, but most of the other international pharmacy graduates coming here, they will have they'll do different other jobs till they clear all the examinations. So I have pharmacists working with me who have worked in, say, McDonald's, or who has worked in service stations. So the earnings, so that they'll earn or keep a job and keep a study at the same time. So and so it is not something which is impossible, and it is difficult in the sense like the amount of study which you need to do, and but it'll be the study part will be much more easier for students who are just graduating now, because they have learned um, um, the science or the basics of it, because I graduated into 2000, and I wrote this exam in almost after 20 years or 19 years. So it is much more easier if you are freshly graduating and then you have all the information fresh in your mind. And if you can do the IELTS part, like communication skills, if you are increasing it, then it's not really a difficult process to become an pharmacist in Canada. Okay, and these are some of the resources which can be used for examination. Comprehensive Pharmacy Review for NAPLEX. NAPLEX is North American Pharmacy Licensure Examination, which is like a US exam. Uh, Unfortunately, there are very few, almost nil textbooks or reference materials or study materials for preparing for PEBC. So we have to depend upon NAPLEX materials or any other materials. Even GATE exam materials also will help with those kind of questions. And compendium of therapeutic choices and compendium of therapeutics for minor ailments. These are like more Canadian oriented reference books. They are not textbooks. They are reference books. But it's Canada specific, and all the exams will be based upon only on the Canadian drugs and the Canadian guidelines. So that's all given in the Compendium of Therapeutic Choices or CTC. And there are some websites like Pharmacy 5 in 5, which is a good uh, website for getting uh, uh, clinical oriented questions which may be useful in the examinations. And PEBC also has sample questions for MCQ and sample questions for evaluating exam, and also some sample videos for the OSCEs. Okay, I think that ends my talk, and this is some photos of the medicine hat where I live. Uh, any questions?
Sir, I have
Sir,
a question.
Yep.
Yeah.
Sir, with the after clearing this examination, whether we can work anywhere in Canada or only we can work in the particular province?
Okay. Yeah, that's a good question. Like once you clear the examination, like the MCQ or the OSCE examination, uh, and uh, you can work anywhere in Canada, provided you are finishing the jurisprudence examination for that particular province. So, and even then, like even after you get your license in, say, in Alberta, and you want to go to, let's say, Ontario or British Columbia, you can practice in Ontario or British Columbia after writing their jurisprudence examination. So jurisprudence examinations are more likely like laws um, which are specific to that province. So once you clear that jurisprudence examination, there is no problem in practicing anywhere in Canada.
sir,
What about
I
this
think some more.
certificate? Whether certificate is valid in the US also, sir?
I don't think it is valid in US because but if you are moving to US, there is an equivalency internship program or something like in US which you need to do. So even people who have studied in US, if they want to practice in Canada, they still have to do the internship in Canada. So for between US and Canada, there can be some interactions which are which is more specific to US and Canada.
sir, how to search a pharmacist assistant job, sir, from India? And if I have an 3x work experience, for example, in a production area, will they consider that, sir?
Okay, so it is mostly a matter of luck if you are applying from outside Canada. Unfortunately, what happens is like uh, Canadian system, they usually prefer some Canadian documentation, like you have done some schooling in Canada or you have licensed in Canada or anything like that. So uh, practically, I will say like searching for a job in Canada from India is it's more like a hit or a miss. It's difficult, I would say. So because especially for a production job or things like you don't need a uh, registration or a license for that, then it's more difficult, I would say.
Thank you, sir.
Sir, any one more question. Any genuine websites are there for applying jobs from India?
I Yeah, there is like once you register in the immigration website, there is a job market or a job site within the immigration website. So the idea is that you are eligible to apply as a PR, or your eligibility is there, you're under processing or something like that, and your resume can go into a job pool where an employer can pull up uh, people who are waiting to come to Canada and offer them jobs. So there is a website, there is a job bank when you register for immigration, but I'm not really sure how effective is that.
Which kind of job will available for a Pharm D student?
Only if you get your license from here, then you'll be a pharmacist here. Yes. Other than if you, as I said, you cannot practice as a pharmacist or not even as a pharmacy technician in Canada unless you have a pharmacist license from Canada or from US, whatever.
So
Sir,
they need.
if I pursue
Sorry.
M.Pharm, sir, if I pursue M.Pharm in Canada, if I'll get job easily, sir. Can I get
Yeah,
job there?
I think if you study some course here in Canada, then you'll get a 2-year work permit in Canada to like 2 or 3 years, I forgot. 3 years work permit in Canada, like where you can work in Canada, stay back and work in Canada. So that's what many will do, but not in pharmacy, but in other things like they'll come here for a course, diploma in something like a 2-year course or something like that, 2 or 3 year courses, and then they can stay back in Canada for 2 or 3 years. So during that time, they'll apply for the permanent residency. That's another option, yes.
So for working in medical shop also we need these certifications, or that is a different process?
For working in a pharmacy or a medical shop, you don't need a certification if you're working as a pharmacy assistant. Like I was working as a pharmacy assistant, so that does not need any certification. So that is like a minimum, that is the starting wage or the minimum wage job. For that, you don't need a certification. And uh, yes.
Any other queries? So I think the Pharm D students will be having, which will be more easier to clear the set examinations in Canada because they are studying more clinical oriented and patient
Yeah.
oriented. So,
Yes, yeah, I also think so. Like in the sense, like if it is more clinical oriented study, then it's more easy to clear the MCQ exam. It's not difficult. Like if you're strong in the clinical aspect, and the OSCE is the point where many of them have trouble. But OSCE can also be cleared if you are if the you get a bit of practice on listening to somebody and talking to somebody. That's the main thing. Without in a proper way, like that comes with more with the practice. Like I know that in Canadian pharmacy school, that is something which they do very routinely. So they're very comfortable at the end of their course to talk to the patient, get the necessary information, and give the necessary information in the correct language. So yes, Farm D, I think it'll be they'll be having much more easier uh, to clear the MCQ.
Any other queries? Any other questions you want to clear? You can clear now. I think it is already midnight in the Canada.
No.
Yeah. Okay. If you have anything, make it fast.
So can I ask you a question?
Sure.
So actually, do Canadian citizens have to go through all these exams and all the bridging programs and all?
Canadian citizen also have to do it unless you have studied in a Canadian pharmacy school. So if you haven't studied in a Canadian pharmacy school, yes, you have to do all this even if you are a Canadian citizen. If you got your degree from outside Canada, then yes, you have to do all this.
Sir, I would like to ask you one thing. Sir, can you hear me?
Yes, I can hear you.
Yeah. If students want to go to US, then through
Mhm.
Canada, it will be a good channel. They can go and work in Canada for some time, and from there they can migrate to US. What are your views on it?
Uh, Maybe it is true, but I really don't know why anybody will want to move to US because US, if I understand correctly from my friends who are in US, the job market for pharmacists is not so great in US, and US system has a different kind of healthcare system. The healthcare system in US is totally different. It is more here in Canada. It is more publicly funded, whereas in US it is more privately funded. So I don't know whether if there is a lot of people moving from Canada to US. I'm not very sure, but maybe that's an option too.
Yeah, okay.
Madam, you are logging in two phones, I think.
Who, me?
Yeah.
My?
Yeah, two accounts you are.
I've logged on in one. I don't remember the second one.
Yeah.
Maybe by mistake I would have logged in another
Yeah,
one also.
you can check. Please check.
Yeah, all right, okay.
Any other queries? Any
Sir,
other?
I have one question.
Mhm.
Sir, can you please tell me which website whether this exams for applying?
Okay, one is this PEBC. The first thing which you need to do is go to. mm, This is the first thing which you need to do is go to the pharmacist gateway. This one, Pharmacist Gateway Canada.
Okay, sir.
That is the first step. And from there, once you finish this, then PBC is your next stop.
Okay, sir.
Okay.
Okay, sir. Thank you, sir.
Sir, I have one more question. Sorry.
Yes.
So in pharmacy, many branches are there, like pharmaceutical, pharmacognostic, like that. So whether
Mhm.
these process is common for all the branches, or it will vary for branch to branch?
No, it is common for everyone because here the pharmacist has only the job of a patient care. So what we call as a clinical pharmacist in India is what is the pharmacist here. So even the pharmaceutics or pharmacognosy or pharmacology, they have like more application or fit roles in pharmaceutical industry. So a pharmacist basically here means only with the patient care aspect. So even the pharmaceutics person instead of that, they consider whoever is doing the pharmacy patient care as a pharmacist. So you may be a pharmacology M.Pharm, but if you're working as a community pharmacist, then you're considered as a pharmacist.
Okay, thank you.
I think
What
in
about
India only we have the PG program where we have the specialization. But they in Canada it was basically the B pharmacy or PharmD was the basic course. UG course was the
Yes.
basic. There is no specialization in the UG. No? Yeah.
No. So yeah, no.
Any queries?
what about salary and all? It is a hourly basis or monthly lump sum salary like that?
Mostly here in Canada, almost all jobs are like hourly basis, and there are some salaried positions also, but mostly everyone is like hourly. Like hourly, you'll get this much hours. Like minimum, I think is $15 per hour in Alberta. That is a minimum for a minimum, like for pharmacy assistant kind job, it is $15. Because when I came here, it was $13. I was working at $13 per hour. Then in a couple of months, the province salary went up to $15. So it's still $15 as a minimum wage. No problem.
Any other queries? I think we can conclude the section. Rajshri? Yes, madam. Sapna, madam.
Yes, no, I don't have a question. I just want to thank sir. Very nicely said and very patiently you have answered the questions. All right. Yes. Rajashri, you can
Okay,
go
thank you,
ahead.
madam.
Yeah.
Okay.
That was a very interesting and informative session. Thank you, Sabarinath sir. Acknowledging the good that you already have in your life is the foundation of abundance. Let's have gratitude for everything and everyone we have. I request Dr. T. Tamil Selvan, HOD, Department of Pharmacy Practice, to kindly propose the vote of thanks. Sir, please.
Yeah, thank you, Rasri. Honorable Chairman and Managing Trustee, sir, respected Principal, sir, Dean, Madam, Vice Principal, sir, and today Honorable Speaker, Dr. Sabarinath, sir, and the entire fraternity of the institution and my dear participants. Very good morning to all. It's my privilege to have been asked to propose a vote of thanks on this occasion. And foremost, I thank our Honorable and respected Chairman and Managing Trustee, Advocate Dr. P. Krishna sir, for his support and encouragement towards the success of this webinar. Thank you very much, sir. We have been fortunate to have the renowned identity from the pharma field, Dr. Sabarinath Chandrasekharan, Staff Pharmacist, Costco Pharmacy, Canada. On behalf of Nehru College of Pharmacy, I extend a really hearty vote of thanks to your sir, that who spared time from his busiest schedule and graced this occasion. Even at the midnight, he is delivering the session with the patients. And today we had an opportunity to hear his views and Canadian pharmacist, what are the licensing processes and opportunities. Thank you very much, sir. We hope surely your speech enlightened our participants' minds and have shown a new path for the new aspirant, those are looking for the international pharmacist opportunities. Thank you very much, sir, for a wonderful session. And a special mention to our respected principal, sir, Dr. K. Prabhu, and respected Dean, Academic Research and Placement, Dr. Shapna Srikumar, Madam, for being the catalyst that stimulated us to do our best. And standing as a pillars of strength. Thank you, sir. Thank you, Madam. With a deep sense of appreciation, we thank our beloved Vice Principal and convener of this webinar, Dr. K.C. Prasan sir, for arranging this wonderful webinar for future aspirant. Thank you, sir. Thank you very much. I would like to thank all the HODs, faculty members, and supporting staff of Nehru College of Pharmacy for their excellent support towards this event. Thank you, everyone. I extend my gratitude to our MOC team and co-conveners for this webinar for making this occasion as a memorable one. Thank you all. And our sincere gratitude goes to all the participants and my dear students and parents who all are participated from the various parts of Kerala. Thank you everyone. Your presence made this even more successful one. Thank you all. Thank you all the participants. Last but not least, I thank our IT team and management team members for their excellent cooperation and arrangements on this webinar. Once again, I thank you all. Thank you very much. And especially today's speaker, Dr. Sabarinath sir. Sir, you have explained very well about the licensing process of Canada, and being a HOD of PharmD program, I hope my students are really enlightened with your speech, sir. There will be the more scope to write the exams and processing of the licensing procedures. Thank you, sir. Thank you very much. And special good night to you, sir. Thank you.
Thank you.
Thank you, sir.
Thank you.
Thank you. Thank you, Dr. Tamil Selvan. Thank you, Rajshri, for the nice MOC and other teams who are worked hard to make this program a grand success, especially our IT team. Thank you very much. And the participants, delegates, really nearly 700 delegates. I am so really sorry that we are able to accommodate only 250 at a time. So remaining people, we will give an link in the, this will be recorded and presented in our YouTube channel. So you can see in the YouTube channel after, if you are missing this presentation, those who missed the presentation. And we will giving a certificate for this participant. Those who fill the feedback form, they will automatically, they will be receiving the certificates. Thank you, Dr. Shabri, for your wonderful patience. And the time is, I know it is midnight in in Canada, and you take your time to explain very patiently to all our delegates. Thank you very much. Thank you from my bottom of hearts. And convey my regards to your family, Soja and kids. They are there, I think. Yeah.
So yeah, Soja is here. So
yeah,
thanks, Prashant, and the entire team. So I'll send over the. I will send over the PowerPoint also.
Thank you.
I'll send the PowerPoint also to you, Prashant.
Okay. Okay.
And yeah, thanks everyone.
Thank you.
Thank you.
Okay. Okay. Good night. Good night.
Good night. Bye.
Good night. Bye. Bye. Rajshri, you can sign off.
Thank you. Thank you, Sabarinath sir.
Thank
We
you.
are obliged to have all you here and thank all the participants and invited speaker wholeheartedly on behalf of our College of Pharmacy. Thank you for being part of this webinar. Thank you everyone. Stay safe and stay healthy.
Bye.
Okay, thank you everyone.
Thank you.